Roy Barton. Evan Solomon is on the National this week. The number of Canadian inmates being put into isolated confinement is on the rise, according to new documents obtained by Power and Politics. Over the last 10 years, total admissions to segregation increased from just over 7,000 inmates in 2003-2004 to more than 8,000 in 2012-2013. Inmates are only supposed to be segregated if the security or safety of the individual, the facility, or other inmates is at risk, or if allowing the inmate to associate with others will interfere with an investigation. But now, Canada's Correctional Investigator says there has been an over-reliance on segregation in increasingly crowded prisons, and it's putting the vulnerable inmates and ultimately the public at risk. Are overcrowded prisons leading to more inmates being isolated? Are more mentally ill offenders being put in segregation instead of getting proper treatment? And is the misuse of segregation simply against the law? Joining me now is Correctional Investigator of Canada, Howard Sapers. Good to see you, Mr. Sapers.
Hi.
What is your understanding of why segregation is on the rise?
Well, it's complicated, and I don't have a full understanding of it. We see more reliance on segregation the more crowded prisons become, and the more complex the offender population becomes. So we've got a lot of gang involvement in prisons. We have a lot of different subgroups in terms of racial and cultural background. We have older offenders as a growing proportion of the overall offender population. All of this together is putting a lot of pressure on CSC to manage all of these subpopulations and try to resolve conflicts. At the same time, we're seeing the use of segregation go up. In fact, we saw such reliance on segregation in the last couple of years. For the first time, to my knowledge, we've seen double bunking inside segregation cells.
Which sort of contradicts what the whole point of segregation is about, right? I mean, you're trying to restrict access to other people, and yet they're sticking two people together in the same cell. How does that make sense?
Yeah, well, it doesn't make a lot of sense at all. If the purpose of segregation is to restrict movement, restrict association, protect people, then it's counterintuitive to start stacking people in segregation cells. Not only that, segregation cells are designed to be relatively austere and relative
small
to the rest of the prison, and typically small. So they're not safe environments. We see a disproportionate number of self-harming incidents take place inside segregation cells. We see a disproportionate number of attempted suicides in segregation cells across the country, and sadly we see a disproportionate number of suicides in segregation units.
So what does that tell you about the way it is being used right now?
Well, it's being overused. Yeah, it's being overused. We've made a series of recommendations over the years. First of all, we've recommended that there should be an absolute prohibition on putting somebody with a diagnosed significant mental illness in a segregation cell. We've also made recommendations that when people are segregated, there should be independent review, independent of the prison site administration, independent review of that placement. Because the law requires that you're to be segregated for the shortest period of time possible, and then put back into general population.
So lots of people, of course, remember the case of Ashley Smith. It came to such prominence because she was a teenaged inmate and she choked herself, as you're saying, these cases of suicide. And this had happened after a prolonged period of segregation for her. Has anything changed since that instance and since that event came to light?
There's been some policy refinements. There's been some changes. There's been some study. There's been some training around mental health issues. So around the edges, things have gotten better, but the number of placements in segregation cells have actually gone up. So the proportion of offenders placed in segregation at some point in their sentence has actually increased since Ashley's death.
So Correctional Service of Canada, when we ask them about this, of course, they say that it's for some of the reasons that you have mentioned, you know, that it's the safety of inmates, staff, and visitors that they are trying to protect in using this, and that the increase has more to do with the fact that there is also an increase in the prison population, and that the kinds of things that are happening inside the prison in terms of trying to detect use of alcohol and drugs and other contrabands, that this is all part of that process. Does that make sense to you? Does that?
Only a little. First of all, we can talk about proportions or percentages or rates. So it doesn't really matter whether the count is 15,000 as it is today or 14,000 as it was a year ago. We're seeing a higher percentage of offenders in segregation. The other thing is that there are other tools other than segregation. There's other population management unit, there's intensive supervision units, there's other forms of interdiction in terms of reducing contraband coming into prisons. So you don't have to rely on the most onerous, the most austere form of incarceration to achieve those public safety ends.
The law actually says quite specifically the Correctional Service of Canada has to use the least restrictive means of custody. So is it following those rules or not really?
Well, we're challenging that. We're saying that they're not, in many cases that we review, they're not applying the principle of least restriction.
So are they breaking the law?
Well, what's interesting is the law was recently changed. When Bill C-10 passed, a lot of the language around least restrictive was changed to necessary and proportionate. And I think eventually the courts are going to have to weigh in and determine whether necessary and proportionate equals least restrictive. It's a little bit of a technical argument, but in our analysis, we see CSC not abiding with the principle of least restrictive custody. And so we make recommendations when we come across those cases.
So they're pushing the line on the law. That would be fair to say?
I think that's a fair way to put it.
Okay, Howard Sapers, thanks for this. Appreciate it.
My pleasure.
We're going to get some reaction to this story now. Should the government do more to ensure that segregation is not being overused? Joining me now in Calgary is Conservative MP Blake Richards. In Vancouver, NDP International Trade critic Don Davies. And in Montreal, the Liberal Public Safety critic Francis Scarbaleggia. Thank you all for being here. Appreciate it. Blake Richards, let's start with you. And let's start on the point that we just finished talking to Mr. Sapers about. And that is that he says that Canada and Correctional Services is not applying the principle of least restriction when it comes to using segregation on inmates, and that in fact the government is pushing the line on that law. What is your response?
Well, there is very specific legal requirements that are necessary to be followed when someone is put in an administrative segregation. And obviously, clearly, it is something that is only obviously intended to be used where it's absolutely necessary, where there's no other reasonable alternative, and it's done to make sure that you're ensuring the safety of the offender, other offenders, and corrections officers. And so there is a very specific set of legal requirements that must be met in order for segregation to be applied in a case. And so I think it's obviously an expectation that those requirements would be followed.
It would seem, though, that they're not. Though, according to these numbers, the numbers have gone up over the past 10 years, and they've gone up quite dramatically, and that is worrying to Howard Sapers and to other people. So, is the Public Safety Minister going to perhaps direct Corrections Canada to adhere to the law more strictly?
Well, I think obviously in these cases there are a number of factors. And I know specifically we look at say the Ashley Smith case, which is obviously a very tragic case, one that concerns us all. And there is an inquiry underway on the circumstances there. I think that looking at outcomes of something like that will be important in terms of determining the appropriate procedures and whether they've been followed in a case like that. Obviously, as a government, the most important thing for us is to ensure that those requirements are being met. We want to make sure that is happening, and the offenders are only supposed to be placed in segregation where it's absolutely necessary, and only where it's necessary to ensure the safety of them and other individuals.
Okay, let's get some of your colleagues to weigh in here. Don Davies, you heard there some of the concerns raised by Howard Sapers about the use of segregation that has been on the rise for about a decade, and then the implication that perhaps the law is being pushed a little bit in terms of how often it should be used. Should there be a recommendation from the government, a directive from the government that Corrections Canada needs to adhere to the law more closely and really only use it in unique circumstances?
I think so. There's a context to this that goes on for a long time. 5 years ago, the Correctional Investigator issued a series of recommendations about segregation and the appropriate use, and one of those was that it should never be used as a tool to deal with mental illness.
Yes.
In 2009, when I was the public safety critic, the Public Safety Committee undertook a study of the provision of mental illness services and addiction services in our correction system, and we toured the country. We went to Britain, we went to Norway, and we wrote an extensive report on how to properly deal with mental illness, and there were some 75 recommendations. 2 years ago, in July of 2011, Minister Taves issued a directive to the correction services that they should implement a very small number of those recommendations. And over the past year, the New Democrats have been asking to see what progress has been made, and we've received no answer. So the bottom line is that segregation is an inappropriate tool to be used to deal with mental illness. This government has been told that repeatedly in many different contexts, and they've simply refused to move on it. And as a matter of fact, as you've heard, they've increased the number of people in segregation in our prisons, and that's going in the wrong direction.
And I'll let Blake Richards respond to that specific point about mental illness and what you and Howard Sapers has been calling for. But Francis Scarpaleggia, do you want to weigh in there on how you think the government should be addressing this? And to be fair, as Don Davies points out, a number of warnings that it has received from a variety of people that segregation is being overused.
Well, I think the problem is that the government doesn't really care, quite frankly. I mean, this is not a one-off thing of an incident here or an incident there. It's been sort of setting this system up for a long time. We heard Howard Sapers say that it goes back to C10 and a change of language. I mean, you don't change language for nothing. You change language because you want to give yourself the freedom to do things a little differently in the future. So this is part of a longer-term trend. And what's worrisome is that this government, again, is going in a trend that is away from what other developed countries are doing. I mean, other developed countries are going away. If you look at Britain, for example, are going away from segregation and so on. And so this is the problem: is that it's a trend, and it's something that the government has set up. And it doesn't really seem to care what the consequences are. It's doing double bunking, which is against the international norms and so on. Okay,
let's let Blake Richards respond there. Can you speak directly, Blake Richards, to the issue of mental illness that Don Davies and Howard Sapers raised as well, in that segregation should never be used when it comes to mental illness? Why has the government not moved on those specific recommendations?
Well, I appreciate the opportunity to respond because I think there is some misinformation, certainly in what we heard from the opposition critics here today. And, you know, certainly mental health issues are something that our government takes very seriously. I mean, you know, in our prison system in specific. I mean, you know, we in Budget 2010 brought forward a mental health strategy, $90 million mental health strategy, which is ensuring, you know, first of all, appropriate training for corrections staff in dealing with mental health issues. It also looks at, you know, better screening procedures in intake for mental health issues, and ensuring that the appropriate counseling and psychological counseling is available to offenders where necessary. And I also want to make very clear, if I could just finish, Rosie, you know, in response to Mr. Davies in particular on you know, segregation, mental health issues are never to be a determinant for segregation to be used. That's only in cases where it's absolutely necessary to ensure the safety of offenders or corrections officers, others in the prison.
So Blake Richards, let me then direct you to my clear question. Would the government consider, or have you considered, an idea to ban the use of segregation when it comes to inmates who are mentally ill? No, that's not on the table.
Well, what needs to happen, and what is happening now, is when offenders are placed in segregation, there needs to be proper assessment, and that is happening, and is to happen within 24 hours of an inmate being placed in segregation, to ensure that they are getting the appropriate mental health treatments that are necessary, just like any other offender within the system should receive.
Okay, Don Davies, Francis Scarpaleggia, I'll let you quickly respond. Don Davies?
Well, I think the Ashley Smith tragedy is full answer to what Mr. Richards just said. I've been in over 20 institutions in this country, and I visited segregation units from coast to coast, and I can tell you that people in segregation are not getting the kinds of counseling that Mr. Richards talked about. I can tell you that people have serious mental illnesses in segregation. They're being kept in segregation for months and months, and in Ashley Smith's case, for years. I mean, there's clearly a crisis in our correction system that Mr. Richards is not acknowledging.
Francis,
and you know, that's just clear to anybody who's watching.
Francis Scarpaleggia, last word.
Yeah, I think if the government really cares about getting this right, it would agree to the recommendation to have an advocate for mentally ill patients, prisoners in prisons, and it would supervise transfers like has been called for. So if it's really serious and sincere about this, then it should create the institutional structures to make sure there are checks and balances in the system so things like this don't happen.
Okay. Francis Scarpaleggia, Don Davies, Blake Richards, I know that was a quick go-around on a complicated issue, but I appreciate you all weighing in. Thanks.
Thanks, Rosie.